Hi, my name is Erin Cusick, and I'm a full-time student on campus at BYU, Idaho, and I will be covering treatments for Lyme disease as well as new discoveries being made within the Lyme disease community. So, the main treatment for Lyme disease right now is prescribing antibiotics. If you go in and get tested for Lyme disease after seeing changes in your body and only having it for a few weeks, your doctor will likely prescribe 2 to 3 weeks of antibiotics. Some of the most common antibiotics that are prescribed are amoxicillin, doxycycline, and erythromycin. All of these are called broad-spectrum antibiotics, meaning that they target bacteria in general. But the only problem is if your Lyme disease is caught and diagnosed after you've had it for a few months, the doctors usually have to make a long-term antibiotic treatment plan to try and rid your body of the bacteria. Treating Lyme disease with antibiotics has shown to usually get rid of all or most of the bacteria in your body. The only problem with long-term use of antibiotics is that they can destroy the good bacteria that your body needs to function properly. So usually, doctors will encourage their patients to take a probiotic at the same time, as well as new treatments are still being researched so that we can find new things to use. There are other homeopathic options for treating Lyme disease. However, scientific research studies done by doctors and scientists who aren't associated with the companies that make some of the products that are used have shown little to no consistency in their ability to treat and kill the bacterium within patients. So some of the new discoveries that are being made within the scientific community, which is exciting. Something that doctors are starting to focus on when treating their Lyme disease patients are called co-infections. A co-infection is when your body is already fighting one kind of bacteria or virus, and then another one comes in and starts to basically run rampant. Because Lyme disease patients are already fighting one type of bacteria, and that is wreaking havoc on their body, having another one can be fatal sometimes because their body is so weak. So doctors are focusing on treating the disease that is not as present within the body so that they can focus on the Lyme disease after that original infection is gone. Also, at Oregon State University, they were doing studies on the insects within pieces of amber in 2014. And so within that amber, they found the presence of the bacteria that causes Lyme disease in one of the ticks in the amber. Which is really cool because this can help us understand that this bacteria has been around for hundreds of thousands of years. In one way, we are sort of really lucky that there was a concentration of people who contracted it in the late 1900s because it started to gain awareness and people started to research it and treatments were found. Chances are people have been getting it for a long time, and it's either been misdiagnosed or just not treated at all, which is very sad. The last thing, is that Johns Hopkins University has just opened a new Lyme disease research facility, which is really exciting. And it gives us even more hope that new treatments and discoveries will be made soon. There's a lot of doctors who are working over there now. And so this is sort of their project. And so those are some of the new discoveries that are being made within the community, and we hope to be seeing even more. So thank you for listening.